Hi everybody, it's Wednesday. Time for a little Wisdom Wednesday. I'm out for my walk today and I'm going to talk a little bit about exercise. So in order to kind of get started, I thought I would kind of review what it is about exercise and why we exercise. I know a lot of you out there are big exercisers, so I'm not really necessarily talking to you, but it's still interesting to understand what's kind of happened culturally in our world, especially in the last 18 months. Exercise has either been increased or significantly decreased, depending on who you talk to. I have seen this in all of my patients. I know for myself, I was not able to get with my trainer and as such did not probably exercise as much as I would have wanted. But now that we're kind of re-entering in, maybe we can all find ways that we can do more and exercise more to improve our overall health and wellness. So just part of our exercise needs to just be incorporated in our daily living, not just an isolated event. We need to be more active. What we are seeing in our culture is that there's just more sedentary living. For instance, back in the 60s, only about 15% of the workforce of U.S. jobs were sedentary. Now that's almost 30%. And that's people sitting 30 to 40 hours a week in just sitting in front of a computer. And if they're not exercising, that may even increase once you get home. So you're sitting 30, 40 hours at work, whether you're working from home or not. And then when you come home, you're doing the same thing pretty much. So, we need to be more cognizant and more aware of movement in our daily living. Parking further away, taking more stairs, just doing more in terms of movement to stay healthy. Now, that being said, we can visit more about what we can do from an exercise standpoint. And why would we exercise? I mean, it's just the fact that we know that higher sedentary living, lower physical activity, independent of each other, increases risk for cardiovascular disease. So it's important that we take advantage of the time that we have each and every day to spend some of that time in mindful movement of some sort. Now, it doesn't have to be the same thing every day, and it doesn't have to be the same type of activity or at the same time. We know that even a minimum of 10 minutes can be of value, especially in people with insulin resistance and people with type 2 diabetes. Even 10 minutes makes a difference in their risk factors. So let's walk through. I just got an article from the Mayo Clinic about the reasons we exercise and why we should exercise. And it's not only just to feel better and have more energy, but to add years to our life as well as life to those years. And, who isn't finding that they're more fatigued? We know that exercise increases cardiovascular benefits. It can help us control our weight, but it doesn't help us lose weight. It combats major health conditions such as diabetes and heart disease and stroke prevention. And in such, we know that exercise can raise HDL. The only thing that can raise HDL, that high density lipoprotein, which is considered the one that's sort of the cleanup lipoprotein, exercise and estrogen are the only two things that do that. So particularly for people who have major sedentary jobs and with high cholesterol, you want to exercise. We also know that it can improve mood. People who have issues with depression and or anxiety, we know that can be exceedingly helpful. In fact, many studies, when you put head-to-head exercise with, say, an SSRI like Prozac, it's as good, if not better. So we can use exercise to really improve mood and overall feeling of well-being. We know it boosts energy. It increases oxygen. It increases oxygen to our tissues. And bringing more oxygen to tissues means that we can create more ATP, which means we are stimulating our mitochondria, those little bitty organelles inside the cells that make energy, which can be exceedingly beneficial. It can promote and improve sleep. Now, we've talked a lot about sleep throughout the year and the importance of sleep. So exercising can promote really good sleep if you're not a good sleeper. It also has been shown to improve sexual health. For women, it enhances their arousal, and for men, it can reduce the risk for erectile dysfunction. So much to be said about exercise and sexual health. And lastly, we know that with aging, community and socialization is exceedingly important because we can get isolated. And certainly we've been more isolated this year, but now as we're moving out and are starting to be around people more, we can get involved in physical activities that are community efforts. Tennis, you can do pickleball, you can be a part of a running group, part of a bike group. Any of these things can be exceedingly beneficial for overall health and wellness for folks. So socialization is last but not least. So let's talk a little bit about how much exercise. Well, we know that the WHO and U.S. Preventive Health Commissions have recommended about 150 minutes of moderate exercise a week. And if you do a lot of high intensity work, you can half that. So for every minute of high intensity work, that equals 2 minutes of moderate exercise. So 75 minutes if you're going to do high intensity work. So that's just your aerobic type work, but also we want to do muscle work. Think that we need to do muscle work probably 2 to 3 times a week, but you don't want to do the same big muscle groups every day because there's going to be little microscopic tears in those muscles and they need time to recover. So you want to have 2 to 3 days of muscle work, whether it's machines or just doing it at home. Push-ups, sit-ups, wall sits. I do wall sits whenever I brush my teeth every morning. So that's getting my quads in good shape. Especially in ski season, I like to do that. But I do it actually all the time. So it kind of helps me time a good couple of minutes just wall sitting. But you can do lunges, push-ups, pull-ups, sit-ups. All of those things are great for just core work. And as we age, doing that core work is exceedingly important for balance. We don't want to have any issues with balance, and we want to do a lot of work with core for fall prevention. And it's also really important that you do more muscle work continually, because if you are not used to doing that, you're just at more risk for injury. So you want to maintain some good amount of just core and major muscle group work besides just your cardio workouts. And then of course, deep breathing. So yoga can be great. Pilates is great for flexibility. And I think that these things are really helpful for folks who are really anxious because of the breathing aspects of that form of exercise. So hopefully that's given you a little bit of insight. And I hope you all are looking forward to a great weekend, a safe weekend. Happy 4th, everybody. And we'll see and talk again next week.